Midazolam. Expanded lecture notes. Midazolam, a widely used benzodiazepine in clinical settings for sedation, anxiolysis, and amnesia. Can cause respiratory depression. Slower than propofol. Knowing midazolam aids in making informed decisions for patient care. Introduction to midazolam. 1. Midazolam is a short-acting benzodiazepine, works quickly and effects don't last too long. Commonly used in anesthesia, for surgeries or procedures. Used in procedural sedation, to relax patients during minor procedures. Used seizure control because it has anticonvulsant properties. Used in ICU sedation, for patients on ventilators. 2. Valued for its anxiolytic properties, reduces anxiety. Valued for its sedative properties, helps patients relax or sleep. Valued for its amnesic properties, causes memory loss of the procedure. Valued for its anticonvulsant properties, helps control seizures. 3. In the ICU, it's frequently given for prolonged sedation in mechanically ventilated patients, because it's potent and can be given in different ways. Available in both bolus and infusion forms, flexible ways to administer. Definition. Midazolam is a water-soluble benzodiazepine that acts on the central nervous system, CNS, to produce sedation, anxiolysis, amnesia, and anticonvulsant effects by enhancing the action of gamma-aminobutyric acid GABA. The definition of midazolam is a water-soluble benzodiazepine that acts on the central nervous system, CNS, to produce sedation, anxiolysis, amnesia, and anticonvulsant effects by enhancing the action of gamma-aminobutyric acid GABA, is a general description based on pharmacological properties of midazolam. Classification of midazolam. 1. Pharmacological class. Benzodiazepine. Means midazolam works like other benzodiazepines on the GABA system in the brain. 2. Therapeutic class. Sedative, hypnotic, anxiolytic. Means midazolam is used to calm or sedate patients and reduce anxiety. 3. Control status. Schedule IV controlled substance in many countries. Means midazolam has some potential for abuse or dependence but is considered to have a lower risk compared to Schedule I-III substances, and it's regulated accordingly in many countries. Chemical properties of midazolam. 1. Chemical name. 8-chloro-6-2-fluorophenyl-1-methyl-4-H-imidazo 1,5-A-1,4-benzodiazepine. This is the specific chemical name describing midazolam's structure. 2. Molecular formula. CHClFn, shows the atoms making up midazolam. 3. Molecular weight. 325.77 grams per mole, the weight of one molecule of midazolam. 4. Structure. Imidazobenzodiazepine ring system, describes the chemical structure type of midazolam. 5. pKa. Approximately 6.15, this affects solubility. At low pH midazolam is water-soluble, at physiological pH it becomes more lipophilic, which helps cross biological membranes. Physical properties of midazolam. 1. Appearance. Clear, colorless to pale yellow solution, describes how midazolam looks in its liquid form. 2. Solubility. Water-soluble at acidic pH. Becomes lipophilic at physiological pH, facilitating CNS penetration, means it dissolves in water at low pH but becomes more fat-soluble at body's pH, helping it get into the brain. 3. Stability. Sensitive to light. Store in a cool place, means midazolam should be protected from light and kept cool to stay effective. 4. Formulation. Injectable solution, oral syrup, buccal preparation. These are different ways midazolam can be given to patients. Mechanism of action of midazolam. 1. Binds to benzodiazepine sites on the GABA receptor complex in the CNS, means midazolam attaches to specific spots on GABA receptors in the brain and spinal cord. 2. Increases frequency of chloride channel opening events when GABA binds. leading to hyperpolarization of neuronal membranes, means when GABA attaches, midazolam helps open channels more often, making neurons less likely to fire. 3. Produces sedation, anxiolysis, amnesia, muscle relaxation, and anticonvulsant effects. So the effects midazolam has because of how it works on GABA-A receptors. Pharmacokinetics of midazolam. 1. Absorption. Rapid after IV administration. Oral absorption is efficient but undergoes first-pass metabolism, means midazolam gets into the blood quickly via IV. Oral doses get broken down somewhat by the liver before reaching the bloodstream. 2. Distribution. Highly lipophilic at physiological pH right-pointing arrow. Rapid brain entry, means midazolam gets into the brain quickly because it's fat-soluble at body's pH. 3. Protein binding. Approximately 97%, means most midazolam in blood attached to proteins. 4. Metabolism. Hepatic via 3-cypriot pounds A4 to active metabolite 1-hydroxymidazolam, means midazolam is broken down in the liver by enzyme 3-cypriot pounds A4 to a somewhat active metabolite. 5. Elimination. Renal excretion. Metabolites mostly inactive, but active metabolite may accumulate in renal impairment, means midazolam's broken down parts leave via urine. Kidney problems might cause buildup of active metabolite. 6. Half-life. 1.5-3 hours may be prolonged in elderly, hepatic, renal dysfunction, or long-term ICU sedation, means midazolam's effects decrease in this time in healthy people, but can last longer in some patients. Pharmacodynamics of midazolam. 1. Onset, IV, 1 to 5 minutes, means midazolam starts working quickly when given IV. 2. Peak effect. 3 to 5 minutes, means midazolam's effects are strongest around this time after IV administration. 3. Duration. 1 to 2 hours after a single dose. Longer with continuous infusion, means effects last this long after one dose. Giving it continuously can make effects last longer. 4. Effects. Sedation, anxiolysis, amnesia, anticonvulsant activity, muscle relaxation. These are the clinical effects midazolam produces. Clinical uses of midazolam. 1. Premedication before anesthesia or procedures, means midazolam is given before to reduce anxiety and cause amnesia. 2. Induction of anesthesia, less common than propofol, means midazolam can start anesthesia but isn't used as often as propofol for this. 3. Sedation for diagnostic or therapeutic procedures, e.g., endoscopy, means midazolam helps relax patients during procedures like endoscopy. 4. ICU sedation for mechanically ventilated patients, means midazolam is used to sedate patients on ventilators in ICU. 5. Seizure control, status epilepticus, means midazolam can help stop prolonged seizures. 6. Anxiolysis in critically ill patients, means midazolam reduces anxiety in very sick patients. Use of midazolam in ICU. 1. Continuous infusion for sedation in ventilated patients, means midazolam is given continuously to sedate patients on ventilators. 2. Long-term sedation, especially if propofol is contraindicated, means midazolam is an option for sedation if propofol can't be used. 3. Seizure suppression in status epilepticus, means midazolam can help stop prolonged seizures in ICU. 4. Frequently used in combination with analgesics, e.g., fentanyl, means midazolam is often given with pain meds like fentanyl for sedation and pain control. 5. Caution. Accumulation with prolonged infusion leading to delayed awakening, means if midazolam is given for a long time, it can build up and cause patients to wake up more slowly. Use of midazolam in anesthesia. 1. Premedication to reduce anxiety before surgery, means midazolam is given before surgery to calm the patient. 2. Part of balanced anesthesia for sedation, means midazolam contributes to overall sedation in a balanced anesthesia approach. 3. Induction of anesthesia in some cases means midazolam can be used to start anesthesia in certain situations. 4. To cause amnesia for perioperative events means midazolam helps patients forget events around the surgery. 5. For anxiolysis sedation in minor surgical or diagnostic procedures under anesthesia care means midazolam reduces anxiety and sedates for minor procedures. Uses of midazolam in emergency settings. 1. Treatment of status epilepticus, prolonged seizures, means midazolam helps stop prolonged seizures quickly. 2. Sedation for patients needing urgent procedures like intubation, means midazolam sedates patients for emergency airway management. 3. Rapid sedation for agitated or violent patients in emergency settings, means midazolam can quickly calm very agitated patients in emergencies. 4. Management of seizures in emergency departments, means midazolam is used to control seizures in ER. 5. Procedural sedation for brief emergency interventions needing reduced anxiety and amnesia, means midazolam sedates and causes amnesia for short emergency procedures. Administration and dosage of midazolam. 1. IV sedation procedures. 1. 0.02–0.07 mg per kilogram bolus, adult means initial dose for sedation in adults. 2. Titrate slowly to effect means adjusts based on patient's response. 2. Induction of anesthesia. 1. 0.1–0.3 mg per kilogram IV bolus, means dose range for starting anesthesia with midazolam. Administration and dosage of midazolam. 3. ICU sedation, continuous infusion. 1. Initial, 0.01–0.05 mg per kilogram per hour, means starting dose for continuous sedation in ICU. 2. Maintenance, 0.02–0.1 mg per kilogram per hour, means dose range for ongoing sedation in ICU. 3. Adjust to sedation target, e.g., RASS-2 to 0, means adjust dose to get desired sedation level using RAS score. 4. Status epilepticus. 1. IV bolus 0.2 mg per kilogram, then infusion 0.052 mg per kilogram per hour, means dose for stopping prolonged seizures. Side effects of midazolam. 1. Hypotension, especially with high doses or rapid injection, means low blood pressure can happen with large or fast doses. 2. Respiratory depression, apnea, dose-related, means midazolam can slow or stop breathing, depending on dose. 3. Paradoxical agitation, rare, means sometimes midazolam causes unexpected agitation instead of sedation, but this is rare. 4. Drowsiness, confusion, ataxia, means midazolam can cause sleepiness, confusion, and unsteadiness. 5. Pain at injection site, less than diazepam, means midazolam might cause some pain when injected, but less than diazepam does. Serious side effects of midazolam. 1. Profound respiratory depression leading to hypoxia and arrest, means severe breathing slowdown can cause low oxygen and even stop breathing. 2. Severe hypotension, circulatory collapse, means midazolam can cause very low blood pressure and lapse of circulation in serious cases. 3. Paradoxical reactions, agitation, aggression, means some patients might get unexpectedly agitated or aggressive instead of sedate. 4. Withdrawal symptoms with abrupt cessation after prolonged use, means stopping midazolam suddenly after long-term use can cause withdrawal symptoms. Contraindications of midazolam. 1. Hypersensitivity to benzodiazepines, means midazolam shouldn't be used if patients are allergic to benzodiazepines. 2. Severe acute narrow-angle glaucoma, means midazolam is contraindicated in severe narrow-angle glaucoma. 3. Acute alcohol intoxication with CNS depression, means midazolam shouldn't be used with severe alcohol intoxication causing CNS depression. 4. Severe respiratory insufficiency, unless on ventilatory support, means midazolam is contraindicated in severe breathing problems unless patient is on a ventilator. Precautions for midazolam. 1. Elderly and debilitated patients. Reduced dose means lower doses are needed in elderly or weak patients. 2. Hepatic or renal impairment. Risk of accumulation means midazolam can build up in patients with liver or kidney problems. 3. Prolonged ICU sedation. Risk of tolerance. Dependence means long-term use in ICU can lead to tolerance or dependence. 4. Concomitant CNS depressants. Opioids, alcohol leading to additive effects, means using midazolam with other CNS depressants increases sedative effects. 5. Use cautiously in myasthenia gravis, means midazolam needs careful use in patients with myasthenia gravis. Advantages of midazolam. 1. Water-soluble formulation leading to less irritation on injection, means midazolam causes less pain or irritation when injected compared to some other drugs. 2. Potent anxiolytic and amnestic effects, means midazolam is strong at reducing anxiety causing amnesia. 3. Can be used in patients with hemodynamic instability, less depressant than propofol, means midazolam can be used in patients with unstable blood pressure, circulation because it affects hemodynamics less than propofol. 4. Multiple administration routes IV, oral, buccal, intranasal, means midazolam can be given through various routes for different needs. Disadvantages of midazolam. 1. Slower recovery compared to propofol, means patients take longer to wake up after midazolam compared to propofol. 2. Accumulates with prolonged infusion leading to delayed awakening, means midazolam builds up with long infusions, causing delayed recovery. 3. No analgesic effect leading to must be combined with analgesics, means midazolam doesn't reduce pain, so pain meds are needed alongside it. 4. Risk of tolerance and withdrawal with long-term use, means using midazolam for a long time can lead to needing more for effect and withdrawal symptoms if stopped. Clinical considerations for midazolam. 1. Titrate slowly to avoid hypotension and respiratory depression, means adjust dose slowly to prevent low blood pressure and breathing problems. 2. Use sedation assessment scales, e.g., RASS, Ramsey, to avoid oversedation, means use scales to check sedation level and avoid too much sedation. 3. Reduce infusion rate in renal or hepatic dysfunction, means lower doses are needed in kidney or liver problems. 4. Consider switching to propofol or dexmedetomidine for faster wake-up if prolonged sedation not needed, means consider other sedatives for quicker recovery if needed. 5. Flumazenil is the benzodiazepine antagonist for reversal in emergencies. Use cautiously, means flumazenil reverses midazolam effects in emergencies but should be used carefully. Comparison of midazolam with other agents. 1. Onset, IV. Midazolam, 1 to 5 minute, propofol, 30 seconds, lorazepam, 5 to 20 minute, dexmedetomidine, 5 to 10 minute. 2. Duration. Midazolam, 1 to 2 hours, propofol, 5 to 10 minute, lorazepam, 6 to 8 hours, dexmedetomidine, 1 to 2 hours after stop. 3. Recovery. Midazolam, moderate, propofol, rapid, lorazepam, slow, dexmedetomidine, moderate. 4. CV stability. Midazolam, good, propofol, less stable, lorazepam, good, dexmedetomidine, good. 5. Analgesia. Midazolam, none, propofol, none, lorazepam, none, dexmedetomidine, mild. 6. ICU sedation. All, midazolam, propofol, lorazepam, dexmedetomidine, yes. Conclusion about midazolam. 1. Midazolam is a versatile benzodiazepine ideal for ICU sedation, procedural sedation, and seizure management means midazolam is useful in various clinical situations like ICU sedation, before procedures, and for seizures. 2. Its favorable hemodynamic profile makes it useful in unstable patients, but its risk of accumulation and delayed recovery in prolonged ICU use requires careful dosing and monitoring, means midazolam is okay for patients with unstable blood pressure but needs care with long-term use in ICU. 3. When used with vigilance, it remains a reliable sedative hypnotic in critical care, means midazolam is a dependable sedative in critical care if used carefully. In critical care, midazolam is like a gentle blanket over the mind. Effective when used wisely, but dangerous if left too long. ICU pharmacology principle.